On-the-scene coverage of ACC 2015 is supported by Effient.
I'm Peter Block in San Diego at ACC 2015 for On the Scene, and with me is Mark Gillenoff. Mark needs no introduction. The surgical wonder from Cleveland Clinic. Actually, that may be overstating it a little bit, Mark.
It is.
But nevertheless, one of the premier surgeons at Cleveland Clinic. And Mark has just reported on left atrial ablation at the time of mitral valve surgery. Mark, an interesting sort of complex area that we all took for granted early, and now we have some data from your trial.
Yeah, the trial answers a very simple question. If a person is having mitral valve surgery and also has AFib, should you do an ablation or should you just do the mitral valve procedure? The answer is, if you want to control rhythm in that patient, do an ablation, because your freedom from AFib will be much greater with the ablation plus the mitral surgery.
And that's freedom at 1 year. This isn't just freedom immediately, right?
Right, actually very stringent. Freedom at both 6 months and 12 months by 3-day Holter.
Okay, so part of the question that I'm sure surgeons will ask is, well, okay, what did he actually do? Is this pulmonary vein isolation? Is it left atrial cutting and burning and so forth? What did you actually do, and was there a difference?
Patients were randomized further to PVI, pulmonary vein isolation, versus a biatrial maze. And the answer, was there a difference? There was no difference in this trial between PVI and a biatrial maze. We weren't powered to detect a difference, but I can tell you this. If there is a difference between PVI and a biatrial maze, it's not very big.
Okay, so a biatrial maze is actually an easier thing to do than pulmonary vein isolation. Is that true, or is that not true?
Well, actually, PVI is the easier one. Pulmonary vein isolation takes 3, 4, 5 minutes. The biatrial maze, where you're in the right atrium and the left atrium, takes a few more minutes.
Okay, but both of them not difficult to do technically?
Right, you're talking 15 extra minutes on cardiopulmonary bypass. So the safety is there, doesn't take much time, surgeons should do it.
All right, one last question. Back in the old days, when everyone thought they knew everything before we had any data, left atrial appendage was always taken when you had mitral valve surgery. What do you do about the left atrial appendage?
Today, I individualize taking it or not taking it because I'm waiting for data. That's the trial we need to do next.
Okay, so from the man who's been there a lot of times, very clearly, Mark, if you'd have mitral valve surgery, you need to have some kind of ablation procedure, and what you do probably doesn't make any difference. The left atrial appendage is still out there.
Yeah, it's waiting.
Thank you very much, Mark.